Hi friends, this is Dr. Jigisha, Medical Head, Vida Skin and Hair Transplant Clinic, Whitefield, Bangalore. So today I am going to walk you through the whole process of the hair transplantation that the patient is going to undertake today in the clinic. So this is not just about hair transplantation, but it is a life-changing procedure for the patient because the hairline that we are going to give him is going to stay for the lifetime. So the hairline which we are going to give him, it should not look like a transplanted hairline. It will look like a natural hairline going further also. So this is not just about transplant, it is about restoring his confidence back as well as transforming his look and rebuilding himself to a new him. So this is Mr. Ashok Kumar. He is our patient and we had a preliminary consultation with him a few days back, and he has taken his time and he has decided to go for the surgery. So Mr. Ashok Kumar, have you understood everything?
Yes, Dr. Jigasha has explained very well. I am a bit nervous still, but I am confident that she will be helping me in a lot.
So Mr. Ashok Kumar, what has led you to choose this place?
My friend again on consultation for his facial treatment for with him. I came for one of the skin treatments as well for this chemical peeling, and that was giving me good results. And Jigasha explained me about the hair treatments and how my hair thinning was happening, and then what are the stages it involved. And I thought this is the best place where it is handled by professionals and you can connect with the doctors easily. So I thought it will be good, and then I decided to take the hair treatment.
So here we can see that the hair is thinning in an irregular fashion. There is no uniform thinning happening. Some of the follicles are not producing hair, and there's lot of spacing between the follicles. There's lot of density reduction that's happening here. We can say the baby hair or the vellus hair which is protruding. Okay, so most of hair are in the stage of vellus transformation, wherein the density is reducing. So his original hairline starting from 7, but when we see the facial proportions, so I decided to shift the hairline a bit lower side so that we can give a triangular outline to the frontal part, and then going backward it would end at around 6.5 to 7. So this is how, it's not a fixed kind of a thing. We need to adjust the hairline according to the structure of the face. So now after putting the headband, we exactly come to know the areas which have to be filled up. We were clear about the frontal part, but now the back area, the backside limit of the transplant is to be determined and has to be marked in such a way. So we have done the shaving part, we have done the washing of the patient, preparing of the patient, we have done, everything is done. Now what we are going to do is we are going to take some test grafts from the backside of the area, the donor area. We are going to take some test grafts and we are going to measure the exact length as well as the width of the grafts, which will decide us to choose the slits accordingly. What is the size of the slits or the holes which we are going to make in the front part. So we have marked the area, this much is the area we are going to cover. So how we are going to plan it? So first few centimeters we are going to plan the hairline, which is going to be very dense in this area. Then this is the central part which we are going to give maximum density. This is called the egg area. Okay, and then whatever is the remaining density, we are going to cover these two parts, and then whatever is remaining, this is the part we are going to fill it up. This is the slit in which we have adjusted the dimensions according to his graft size. We have adjusted the dimensions in the slits. These are custom cut blades which are designed to be used according to the size of the grafts of the patient. So now we are going to the slit making process. So when we start the slit making process, the angle in the frontal hairline is usually 30 degrees, and then when we go behind, the angle becomes more towards the 90 degrees side, and we should not be giving slits on the existing hairs. So we need to check the existing hairs as well as follow the grid pattern. So what we have done is we have marked the donor area of the patient, and now we have given the anesthesia also. So now we are going to start the extraction process. This is the punch with the help of which we are going to extract the grafts. So the beauty of the punch is that this is a blunt punch. This is not a sharp punch. So when it goes inside the skin, it doesn't produce so much of a bleeding. It doesn't cut the root of the hair, which I'll be showing it to you. So if it is a 3 root graft, we'll get 3 root. If it is a 4 root graft, we'll get 4 roots. So this is very important. Like if it is a sharp punch, the chances of damage to the roots is very high. But here what we are using is a completely blunt punch. So I've just extracted the grafts. So these are the grafts, how it looks. And you can see that there is no damage to the grafts. If it is a 2 graft, 2 roots are there. If it is a 3 root graft, the 3 roots are intact here. So there is no damage or there is no transaction happening here, because of which the quality of transplant becomes to the next level. Okay, and the whitish portion that you see which is attached to the graft, that is the bulge area, which is very, very important for the growth of the hair. When you implant it, if this is intact, the growth of the hair will be very good. So this should be there. It is a fleshy graft, it is an intact graft, there is no transaction. So this kind of grafts are considered to be of good quality, and extracting this kind of grafts with a blunt punch is what we practice here.